Everybody. The topic for this session is external carotid artery. The objectives are the common carotid artery, branches and clinical aspects, the external carotid artery, branches and their brief description. And at the end, few questions are given as assignments. Common carotid artery. The right common carotid artery is a branch of the brachiocephalic artery. It begins in the neck behind the right supraclavicular joint. The left common carotid artery is a branch of the arch of aorta. It begins in the thorax, in front of the trachea, opposite little left of the center of the manubrium. It ascends to the back of the left sternoclavicular joint and enters the neck. Surface marking. To mark this artery, it is on the right side. The first point is taken on the sternoclavicular joint and the second point on the anterior border of sternocleidomastoid muscle at the level of the upper border of thyroid cartilage. To represent on left side, along with these 2 points, another point is taken slightly to the left of the middle of the manubrium sterni, midway between the suprasternal notch and the sternomanubrial joint. Joining these 2 points by broad band or double lines represents the artery. The branches is given at the level of the upper border of thyroid cartilage. The artery ends by dividing it into the external carotid artery and the internal carotid artery. The clinical anatomy. The common carotid artery can be compressed against the anterior tubercle of 6th cervical vertebrae. The carotid pulse is the steadiest pulse within the body. The carotid vessels are exposed during optional arterial surgery for aneurysms, arteriovenous fistulae or arteriosclerotic occlusion. External carotid artery. It is the terminal branch of the common carotid artery and it is the chief artery to supply the front of the neck and the face. Surface marking. The first point is on the anterior border of the sternocleidomastoid muscle at the level of upper border of the lamina of the thyroid cartilage, and the second point is on the posterior border of the neck of the mandible. So joining these points by italic F-shaped double lines which are gently convex forward in the lower of and convex backward in the upper of represents the external carotid artery. Course and relations. It begins in the carotid triangle at the level of upper border of thyroid cartilage between 3rd and 4th cervical vertebrae. It ends in the substance of the parotid gland by splitting into superficial temporal and the maxillary arteries. It has a curved course. In its lower arc, it is anteromedial to the internal carotid artery and in the upper part it is anterolateral to the internal carotid artery. In the carotid triangle, it lies under cover of the sternocleidomastoid muscle and it is crossed by the cervical branch of facial nerve, hypoglossal nerve, facial, lingual and superior thyroid vein. So in the deeper aspect, it is related to the wall of the pharynx, the superior laryngeal nerve that divides into external and internal laryngeal nerves and the ascending pharyngeal artery. Above the carotid triangle, it lies deep to the substance of the parotid gland. Within the gland, it is related superficially to the retromandibular vein and the facial nerve. Deep to the external carotid artery, it is related to the internal carotid artery and the structures passing between the external and the internal carotid artery. That includes the styloglossus muscle, stylopharyngeus muscle, glossopharyngeal nerve, the pharyngeal branch of vagus and the styloid process. Branches. The external carotid artery gives 8 branches. That includes anterior branches are 3, posterior branches are 2, medial branch 1 and the terminal branches are 2. So, the anterior branch includes superior thyroid artery, the lingual artery and the facial artery. The posterior branches includes occipital artery and the posterior auricular artery. The medial branch include the ascending pharyngeal artery. Here in this picture it is not visible. The terminal branches includes the maxillary artery and the superficial temporal artery. So this is the picture showing the branches in the dissected specimen. The CCA represents the common carotid artery, the ICA internal carotid artery, ECA external carotid artery. So the branches of the external carotid artery is represented in black color. So one by one we will discuss about each artery. The first, the superior thyroid artery. It appears from the front of the external carotid artery just below the tip of the greater corner of the hyoid bone. It runs downwards and forwards parallel and superficial to the external laryngeal nerve. It passes to the infrahyoid muscles to reach the upper pole of the lateral lobe of the thyroid gland. The branches, it gives anterior and the posterior branch. The anterior branches are named. They are infrahyoid branch, which anastomoses with its fellow of the opposite side. The sternomastoid branch to the sternomastoid muscle. The superior laryngeal artery, it accompanies the internal laryngeal nerve, enters deep to the thyroid muscle and pierces the thyroid membrane to supply the larynx. Cricothyroid branch enters across the cricothyroid ligament and anastomoses with its counterpart of the opposite side. The glandular branches to the thyroid gland, one of which anastomoses with its fellow of the opposite side along the upper border of the isthmus of the thyroid gland. The posterior branches are small and unnamed. The clinical significance. The superior thyroid artery and the external laryngeal nerve are close to each other higher up, but it diverges slightly near the gland. So, during thyroid surgery, the ligature of this artery should be made close to the gland to avoid injury to the external laryngeal nerve. Next artery is lingual artery. It arises from the external carotid artery opposite the greater corner of the hyoid bone. It splits into 3 parts by the hyoglossus muscle, that is first part, second part and third part. The first part is located in the carotid triangle and forms a loop. The loop is crossed superficially by the hypoglossal nerve. The loop allows the free movement of the artery over the hyoid bone. The second part is located deep to the hyoglossus muscle along the upper border of the hyoid bone. The third part, it is also known as arteria profunda linguae or the deep lingual artery. It first runs upwards along the anterior border of the hyoglossus muscle and after that forwards on the undersurface of the tongue, where it anastomoses with its fellow of the opposite side. The branches of the lingual artery, from the first part it gives the suprahyoid branch which anastomoses with its fellow of the opposite side. From the second part, the dorsal lingular artery, generally 2 in number, it supplies the dorsum of the tongue and the tonsil. From the third part, sublingual artery which supplies the sublingual gland. So the third part continues as the deep lingual artery. Clinical significance. In surgical removal of the tongue, the first part of the artery is ligated before it gives any branches to the tongue or the tonsil. Next artery is facial artery. It arises from the external carotid artery just above the tip of the greater corner of the hyoid bone. It split into two parts, the cervical part and the facial part. The cervical part of the facial artery ascends deep to the digastric and stylohyoid muscles. It enters deep to the ramus of the mandible where it grooves the posterior border of the submandibular gland. Afterward, it makes S-shaped bend, first bending downwards, that is the convexity upwards over the submandibular gland, and after that upward with convexity downwards over the base of the mandible. The facial part of the facial artery starts where the facial artery winds around the lower border of the body of the mandible in the antero-inferior angle of the masseter. Branches of the facial artery from the cervical part that supplies the neck includes the ascending palatine artery. It originates near the origin of the facial artery, ascends and accompanies the levator palati, enters over the upper border of the superior constrictor and supplies primarily the palate. Glandular artery, it supplies the submandibular gland. Submental artery is a large artery which runs forwards on the mylohyoid muscle along with mylohyoid nerve. It supplies the mylohyoid muscle and submandibular and the sublingual salivary gland. Another branch is the tonsillar artery, which is the principal artery of the tonsil. It pierces the superior constrictor and ends in the tonsil. Branches from the facial part. It includes the inferior labial artery which supplies the lower lip. The superior labial artery supplies the upper lip, and the lateral nasal artery to the ala and the dorsum of the nose. The clinical significance. The facial artery compression. Applying pressure to the facial artery as it passes over the inferior border of the mandible just anterior to the angle will diminish the blood flow to that particular site. So next artery is the occipital artery. It originates from the posterior aspect of the external carotid artery opposite the origin of the facial artery. It runs backwards and upwards under cover of the lower border of the posterior belly of digastric muscle superficial to internal carotid artery, internal jugular vein and the last four cranial nerves. In the carotid triangle, it gives two sternocleidomastoid muscle branches. Then it crosses the apex of the posterior triangle. Finally, it pierces the trapezius from the midline and comes to lie along the greater occipital nerve. The branches of the occipital artery includes the sternomastoid branch, generally 2 in number. They run downwards and backwards and supply the sternocleidomastoid muscle. The upper one accompanies the spinal accessory nerve and the lower one is hooked by the hypoglossal nerve. The mastoid branch enters the cranial cavity via mastoid foramen and supplies mastoid air cells. The meningeal branches goes into the cranial cavity via the jugular foramen and hypoglossal canal to supply the dura mater and posterior cranial fossa. Muscular branches supply the adjoining muscles. The auricular branch supplies the cranial surface of the auricle. The descending branch breaks up into superficial and deep branches. The superficial branch anastomoses with the superficial branch of transverse cervical artery and deep branch anastomoses with the deep cervical artery. The clinical aspect. The descending branch of occipital artery gives the main collateral circulation after ligation of the external carotid or the subclavian artery. So next artery is the posterior auricular artery. It appears from the posterior aspect of the external carotid artery a little above the occipital artery. It crosses superficial to the stylohyoid muscle, runs upwards and backwards parallel to the occipital artery along the upper border of the posterior belly of digastric muscle and deep to the parotid gland. Subsequently, it becomes superficial and is located on the base of the mastoid process, supporting the ear which it supplies. The branches includes the stylomastoid artery that enters the stylomastoid foramen to supply the middle ear, mastoid air cells and facial nerve. The auricular branch supplies both cranial and lateral surfaces of auricle. The occipital branch supplies the scalp above and behind the auricle. The ascending pharyngeal artery. It is a slight artery that originates from the medial aspect of external carotid artery near its lower end. It runs vertically upwards between the side wall of the pharynx and internal carotid artery up to the base of the skull. Branches of this artery includes the pharyngeal and prevertebral branches that supplies the corresponding muscles, the meningeal branches which traverses foramina in the base of the skull, inferior tympanic that supplies the medial wall of the tympanic cavity, palatine branches which follow the levator vellae palatini to the palate. Superficial temporal artery. It is the smaller but more direct terminal branch of external carotid artery. It starts behind the neck of the mandible, deep to the upper part of the parotid gland. It runs vertically upwards, crossing the root of zygoma in front of the tragus where its pulsation can be felt. Above 5 cm of zygoma, it splits into anterior or the frontal branch and the posterior or the parietal branch which supplies the temple and the scalp. The branches of the superficial temporal artery includes the transverse facial artery that runs forwards across the masseter below the zygomatic arch, anterior auricular artery that supplies the lateral surface of auricle and external auditory meatus. The zygomatico-temporal or the orbital runs forwards along the upper border of zygomatic arch between the two layers of temporal fascia and reaches the lateral angle of the eye. Middle temporal branch runs on the temporal fossa deep to the temporalis muscle and supplies temporalis muscle and fascia. The terminal branches includes anterior, that is frontal branch, and the posterior, the parietal branch. The anterior branch supplies the muscles and skin of the frontal region. It is quite tortuous and anastomoses with the branches of the ophthalmic artery. The posterior branch supplies the skin and the auricular muscles. The clinical aspect. The pulsations of the superficial temporal artery can be easily felt in front of the tragus of the ear. So maxillary artery, it is the larger terminal branch of external carotid artery. It begins behind the neck of the mandible under cover of the parotid gland. So it will be discussed in detail in the infratemporal region. So the questions for the assignment. The first question, common carotid artery, its course, branches and applied aspects. Second one, describe the external carotid artery under following headings. A. Origin. B. Course and relations. C. Branches. D. Applied anatomy. Third question, the facial artery, origin, course, branches and applied anatomy. And the last question is, lingual artery. Thank you.